Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, I'm so excited. I'm here today talking about our Gold Neonatal Online Conference 2024. It is that time of year once again, and I'm delighted to have two of our speakers here today, Carole Kenner and Carole Jaeger, who are going to be here presenting as keynotes as part of our conference. Now, as a keynote presentation, this presentation is going to be open access and free to all of you. There's absolutely no reason why you can't join us, so I'm truly excited. The other reason why I am so happy, and we've been talking about this at Gold for some time now, is the topic of this presentation: zero separation in the NICU, implementing neuroprotective and family-centered care. I know it's a huge topic. Many of you follow this. Many of you are truly invested in this topic. But I have to say, after reviewing all the presentation today and having such a wonderful time getting set up, Carole and Carole, you really do such a great service in showcasing how much you're invested in this work. So let me just start by asking you, Carole Kenner, tell me, why is this so important to you, this topic? What have you seen in your time that has just driven you to the core to make sure that people get this message?
I love working with families, but in the days when I first started nursing in the NICU, we weren't very supportive of families, and we also didn't know about positioning and about putting the baby's development at the forefront of care. And that's really what drove me to begin to learn more of the evidence to support how we neuroprotect the baby and support the families.
Oh, that's wonderful. And for you too, Carole, I know Carole Jaeger, you've been here doing this for quite some time. We don't need to say how long, Carole, but I know you indicated, you have been invested in this for a long time too. Can you tell me some of the things that you have been just so happy to see change over time?
Sure. Yes, I do go back quite a ways in neonatal care. And what we've discovered is that we spent a lot of time learning about the baby, learning the physiology, learning how to keep babies alive, how to be able to support them at younger and younger gestations. And just as Carole Kenner said, what we've learned is that we kind of miss the whole piece of the family and the baby being nurtured. And
Mm,
we've now learned that by keeping the family and the baby together, we actually can reduce some of the stress that the baby felt and the mother felt, father too, and be able to keep them together so that that neuroprotective care is helping with the nurturing, the survival, and the support of the baby.
wonderful. Yes, some of the really positive things that we've been learning through our experiences for sure. Carole Kenner, tell me about some of the gaps that we're seeing right now. You're going to be talking a little bit about the post-COVID gaps. What is happening? What has gone wrong? Tell us where we're at right now as far as you can see in our NICUs.
I think we made a lot of strides before COVID of really practicing zero separation, of really treating the families as not visitors, but true parents and allowing them to develop their parenting role while still in the NICU. But once COVID shut everything down, we became very protective of the babies, of course,
Hmm.
worried about infections. That makes sense. But even as we started coming out of the pandemic and recognized that families needed to come back into the NICU to be with their babies, there was a lot of restrictions that I'm still seeing, that we haven't given up that fear of infection, that fear of COVID. And we've also got a group of younger nurses that frankly had never worked with parents. They came on in our ranks as new nurses during the pandemic and had never had that interaction. So they also are having to learn how to interact with families and how to embrace the notion
Mm.
that the baby and the family is at the center of care. So I think we're making progress, but we haven't gone back to pre-COVID, in my view.
Right. That's so interesting that you talk about the staff. I never thought about the fact that we had new staff starting right through that period where they didn't have to or weren't taught, how to interact with families. So that is certainly something that, is a nuanced behavior. Carole, Jaeger, tell me, in your experience, are you communicating with staff, or are you hearing this conversation amongst staff and students that this is the gap that you're facing? And sort of what is the conversation saying? Are there different camps? Are there people, sort of disagreeing about what needs to happen next? Or is there a consensus that there needs to be this unanimous change?
I think it's both. I think we've realized that we need to go back and recapture some of the thought process and the engagement that the staff had before. We've also learned that since COVID, our staff shortages are a little bit more pronounced.
Okay.
So the staff who were there have to kind of regain their skills, but they're also the ones who have to mentor and coach the new nurses coming on, the ones that Carole have been talking about. So it's adding much more for nurses to do,
Mm-hmm.
for nurses to think through, to be able to re-engage the team concept, because there are many more team members other than nurses who contribute to family-centered care and neuroprotective care for preemies and sick babies. And we just need to regain that process.
Yeah, absolutely. And for you, Carole Kenner, tell me a little bit about the staffing and how they're seeing things. This is intensive, it seems, at this point, because we're having to go back. Are you seeing things like compassion fatigue and things like that? Are you seeing people fall off where they feel they can't do this job anymore, or they work so hard to get to where they are? What type of things are you seeing that can be put in place in order to support those nurses who are on the floor?
Yeah, I unfortunately do see that the burnout, the compassion fatigue is continuing because during the pandemic, you're in sort of that mode of uh, you just have to keep going, you have to push through it. When the pandemic was officially over, um, I think much of the public thought we would just go back to the way it was, but you
Right.
can't because you've experienced a trauma and the
Mm,
staff has experienced a trauma. And as both Carole and I have said before, the staffing shortages are not necessarily getting better. And so
right.
if you're working staff, and we've done, many surveys in nursing since the pandemic started and afterwards that says, if I can't give the quality care that I want to, if I can't meet the needs of the patients and families that I
Hmm.
serve, then I don't want to be here anymore. And
Yeah.
so trying to have nurse managers recognize that sometimes flexibility, sometimes the ability to say, I need a mental health day, which is not popular. I need
Right.
a day off. Other things that we can do that we often don't think about. Sometimes just listening to what the concerns are, even though we're already overworked. And I can hear
Mm,
some of the audience saying, yeah, we don't have time for that. But you don't have time not to do that because we have to listen and we have to recognize, especially those of us as leaders, what can we do to support staff so that they can keep going? Otherwise, they're depleted and they can't serve the families and the babies.
mm. Wow, that is a lot to unpack there, but I can so empathize and I can hear and see, and I've, seen it myself in the NICUs. Carole, Jaeger, what's the inspiration? What's the takeaway that I know for a lot of NICUs, there is a lot of people that are drivers, people that are still inspired, people that are coming in that are new. So tell me what you're seeing, as far as, I mean, look at the two of you, you're still advocating, and making sure that the message is moved forward. But what have you seen that has been a positive for you in order to really see things continue to, again, reevaluate what was done and what we can do moving forward?
Well, I think folks, um, the whole team, realize that they are people, and the COVID pandemic has made us all realize that we have to think about ourselves as well as our patients. So that
Right.
balance has to occur. And I think we're beginning to see that and realize it. But moving forward means taking kind of a new mindset with us and realize that the way that we had been operating in terms of being very specialized in our service, we now need to kind of bring that together, focus more on the family and just that interpersonal dialogue between the team and between the family. It kind of brings that emotional component, that families, camaraderie, spirit, teamwork together, so that we can really focus more on our families. And we want us to bring our knowledge, our intelligence to our work, but we also need the balance of where the family is, their emotional component, and their cultural state.
I love that. Thank you so much. It's inspiring. And I know for your presentation, so many people are going to have great tools to take away, to take back to their units, to reignite some of what they so many people are talking about that want to do. Zero separation in the NICU, implementing neuroprotective and family-centered care with Carole Kenner and Carole Jaeger. Thank you so much for joining me here today. I am truly looking forward to your presentation. Of course, for all of you joining us live right now and listening in, you'll be able to go over to the website to goldneonatal.com right now and register for this event. I can't wait to see all of you online. Thank you again to Carole and Carole for being with me here today, and have a wonderful rest of your day. Bye-bye, everyone.